Dr. Shetty, thank you very much for being on Duologue. It's a pleasure to have you with us.
Thank you. It's my pleasure.
The one aspect of your profession which has made you a legend is what you have initiated in making healthcare affordable to Indians. You wanted to disassociate wealth from health. So you've spoken that at length. You've spoken how countries which have got robust healthcare system, there are three aspects to them. They're small countries with less population, then the tax to GDP ratio should be at least about 30%, and then allocation to healthcare sector should be at least about 10% plus. And all these three parameters, we don't find ourselves very comfortably placed. So what would be the way forward for us?
Barun, I have a very interesting prediction.
Right.
And I'm convinced it's going to happen.
Right.
India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that wealth of the nation, wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. And you may wonder how long it's going to take.
Yeah, that's a question I would naturally have.
Yes.
So whether is not the question, when is the question?
When is the question? It will happen within 5 years. India is very unique in bringing about paradigm shift in how things are done. You just look at what we have done with mobile communication. Mobile communication today has reached virtually everyone in India. I know of many countries in the world, small countries, but rich countries, some of the richest countries in the world, where significant population do not have data in their mobile phone. It's too expensive. In India, even beggars watch movies in their phone. So we have dissociated mobile communication from affluence.
Right.
No one talks about mobile, whether it's the internet or whatever, as unaffordable. We have dissociated entertainment from affluence. Today, the richest man and the poorest man living in a slum has access to same entertainment channels, OTT platform or whatever. Maybe the rich man watches it in his very expensive TV and the poor man watches them in his inexpensive mobile phone. But it is the same channel, same program. We have democratized entertainment. The same thing we are going to do it in healthcare. Why it will happen in healthcare is because healthcare is not limited by any finite components. Like if the Indian government decides to give a car free of cost to every citizen, it's not possible because car is made up of atoms. It needs steel, it requires oil, it requires all kinds of the metals and all these kinds. Whereas healthcare is not bound by any finite component. Healthcare is delivered by people. And when I retire or when I die, somebody else is going to take over. It's a matter of giving the skill. And today, we produce perhaps the largest number of doctors in the world. You cannot believe today, in the last 7-8 years, our government has virtually doubled the number of medical seats. From 55,000 medical seats to nearly 110,000 medical seats. We produce the largest number of doctors in the world. We produce the largest number of nurses in the world, the largest number of medical technicians in the world. We are the pharmacy of the world. We have everything going. Our only missing link is the affordability to buy the healthcare. That is going to change with the government changing its approach towards health insurance. In a very short period of time, whatever you have seen, those UPI moment and whatever you have seen, the same type of a transformation will happen in healthcare. Everyone is going to have a health insurance. Now, why this is important? Because Today, people have a wrong impression about a health insurance. In healthcare delivery, today in health insurance, there are the three main stakeholders. There is health insurance company, there is hospital,
there's a patient.
There is patient. Hospitals do not trust the health insurance company.
Patient doesn't trust
health insurance doesn't trust
and the patient doesn't
hospital. Patient doesn't trust both parties. So you have a system of delivering healthcare, which is the most important service for this civil society, managed by three stakeholders who don't trust each other.
Trust deficit. Yep.
Yes. Now this is going to change when hospital like ours become health insurance companies. Then the whole concept of conflict of interest will be addressed. As a heart surgeon running heart hospital, more people develop heart attack, it is better for my business. I have absolutely no incentive in preventing people from developing heart attack. The moment I become a health insurance provider, the equation is going to change. If people remain healthy, I save money. If people develop heart attack, I lose money. So I will go out of my way to make sure that people remain healthy.
Duologue with Barun Das featuring Dr. Devi Shetty. Streaming on the world's first news OTT, News9 Plus. Download now.